Good morning, everybody. Advances in skin therapy technologies now enable targeted biological changes within the skin, improving tissue regeneration and advancing persistent skin conditions. By reaching beyond the epidermis and the dermis, we are now at targeting the vascular, the neural, and the extracellular matrix networks that reside within the body. These technologies can stimulate collagen and elastin synthesis and enhancing cellular repair and support a healthier skin function. In achieving such changes, the old soul consultation process is now grossly deficient, and therefore it urgently needs an upgrade, so not just to just how we view the skin, but the whole consultation system is now reaching a new level. So today I am delighted to introduce our expert panel, and we're really very excited about today's topic because it's one that a lot of people have been require a lot more knowledge and updates. So the topic today is transforming the consultation process to strengthen risk management, regulatory compliance, and better treatment outcomes. So first of all, let me introduce Melissa Pritchard of Skin Solutions Canberra, Deanne Casey, Director of Deluxe Skin Boutique, and also our Gay Wardle Skin Institute author, and also author of the new Mastering the Consultation Manual, which is making a lot of buzz at the moment. It's a huge work of love that she's put together. Additionally, we have Leanne Comamond, who is a psychotherapist and founder of the psychodermic analysis. Now, Leanne has extensive clinical academic experience in the area of psychological factors that relate to skin health and aging. She hasn't been able to physically be present, but she's given me her information that I can then present on her behalf, and we can all discuss. So starting out, we're going to start with Gay. And so Gay, your question is, how does the integrating neuroscience principles in human behavior within the consultation process help to strengthen the communication and practitioner-client relations? So basically, what we want to know is what are the studies showing you, and in your manual that you've developed, how are you reshaping the way that people view each other and allow for a deeper connection?
Sure, Tina. Thank you for asking that question as well. It's something that I've done a lot of research, a lot of study on. So, when we think about neuroscience, it really explains why a good consultation technique works. It turns being a good listener into evidence-based claims. And I think that's really important. And I think one of the things that we really do need to do when we're going through a consultation is create safety before content. So the nervous system runs a constant unconscious threat assessment, does that all the time. This theory is called the neuroception. If a client's brain registers a consultation as even mildly threatening, then an undertone clinical detachment, or they have no eye contact, or they have that kind of salesy undertone and that clinical detachment, then their system shifts, the client's system will shift towards defense. The blood flow and processing power move away from the prefrontal cortex, and they become less able to reason, disclose honesty, or take in what you're telling them. They just don't listen. So before any information exchange can work, the practitioner's job, our job, is psychological. We need to have a calm voice. We need to have an unhurried pace. open posture. Don't sit there with your arms crossed or, look like you're uninterested. We need to have that very welcoming, open posture and really genuine attention. That's a co-regulation. So you're leading the client a more regulated nervous system to a borrowed form. And the second part of this is I've broken this down to three parts. The second part is attunement and trust. So reflecting and reflective listening, naming the client constantly throughout the consultation is an emotion that's actually, and they respond to that. When people hear their name all the time, they actually respond to that. And they respond with a warmth towards us. Also, too, we have that pathways that are felt with experience being that they feel that they really understood, that we're really listening, they really understood it. Associated with the oxytocin release, that's a neurophone that we have, and reduced cortisol. So their stress levels are going to actually reduce, they're going to calm down. And when their stress levels reduce and that oxytocin is released, they actually start to receive, they're more receptive, and they start to listen to us as well. So practically, this is why paraphrasing back with what someone says, like if someone says to you, I'm really, just say they're really concerned about pigmentation. So if you continue to paraphrase that back through your consultation, like using that word pigmentation, the way we treat pigmentation is really important. Pigmentation is caused by X, Y, Z. So through the consultation process, we're going to really understand why you have that pigmentation. So that paraphrasing is really, really important, that we actually give that feedback to them all the time throughout the consultation. That's not a soft skill. It's a document shift in the psychological state of that person. And the third part is it compounds over time. So repeated experience of feeling safe and understood build a relational template with you and the client. They actually, if they feel safe in a safe space, they're going to trust you. They're going to start to listen to what you've got to say. The client's brain starts predicting safety in that relationship. And that's a really big shift. That lowers baseline defensiveness. So, they're not going to be defensive about what you say. They're not going to put their arms up in the air going, I'm just being sold to here. They actually, that become more comfortable. In future sessions, they're more comfortable with you as well. And this makes them more receptive to feedback. So they really genuinely want to hear what you've got to say about them. So more willing to disclose difficult material and more able to engage with problem solving rather than just surviving the conversation. So integrating neuroscience into consultation reframes rapport building from an emotional social nicety into a mechanism that determines whether the client's brain is even in the state to think clearly, tell the truth, or take in advice. So it strengthens communication because a regulated nervous system is a precondition for higher order processing, and it strengthens the relationship between attunement, engages the brain's trust, and rewards systems directly. You just can't reason with the brain that doesn't feel safe. If the brain's not feeling safe, it's not going to take anything, and you can't reason with that. So before I give information, I always make sure the person in front of me feels like they're seen, heard, and they're in a really safe space.
Yeah, well, what we're seeing is that I think because the treatments now, as we all know, to really change the skin, especially as we're entering the dermis and we're creating chemical changes and biological changes, it can't be done instantly. It's got to be a journey. So this is why I believe the need for neuroscience to help us make that connection is so important, because it's about building you don't want that person to cancel the next treatment. if it's very superficial, it's easy to say, "Oh, I'm busy, I'm not going." But if you put all that effort to really connect with that person in a meaningful way, where the expectations and the trust is there, and I know your questions about trust, but what I'd like to open it up, and the thing I just want to say is, I strongly believe there is a need for the neuroscience to be separated from the skin disorders, etc., because we tend to be very heavy in the skin disorders and we have very little understanding how we can hold that person's attention. So, in many ways, and I've seen that with Gay's manual, it's 170 pages. It really reinforces a lot of principles, and it warrants for it to be a standalone document because it's a new area of skills development that we all have to understand. So I'm just going to open it up now. Melissa, what are your thoughts with what Gay has shared?
I think it's so important. It's understanding why someone is there, having that meaningful connection, and not just here's a form, fill this in, and then we're just going to do this treatment. It's actually building trust before you even touch the person. It's so important.
Mm.
And these days things are more aggressive, they need more education because of misinformation that's in social media and things like that. So you need to be able to sit with somebody and get them to understand why they should trust you to do it over the person down the street or the person on the internet, even, and build that rapport and the shared decision making. And so that you can get them the outcomes that they're looking for. Without that, they're never going to trust you. They won't take your recommendations. They won't get the outcomes that they're looking for. And they're actually more likely to go down the street.
Yeah, and cancel any further treatments because they don't see, they don't see because the physiological is slow, but the link has to, the psychological has to be stable to give the physiological opportunity to manifest. If you're not giving things enough time, and if you don't spend enough time building that trust, they're not going to hang in with you, and that's a danger. Okay, Dee, your thoughts?
Yeah, absolutely. Look, I come from a point of yes, trust, but also it comes down to rapport building. So building that relationship from the get-go with your client. So what I actually mentor and train my team is take that time to be a really good active listener. Sit down, eye to eye contact when you're in the consultation room. Listen to what they're saying. And yes, as Gay was saying, repeating back, paraphrasing, going through everything that that client has actually talked about is really powerful to the point where that client feels comfortable and confident to go on that journey with you. So I get goosebumps when towards the end of a consultation, a client is actually nearly in tears. And I don't want that, but it's more so a tear of thank you so much. No one has actually taken that time to ask me questions or to listen to understand truly what it is that I'm going through in my skin and in my journey.
Okay, so Dee, your question is about the barriers to trust and what can prevent trust and how do you overcome the lack of trust? In other words,
Mm.
your opinion, why do you think people don't trust? How do you define that? And what strategies would you use and approaches would you use to redeem that trust?
Yeah, so when we approach, let's say, from a consultation perspective to build that trust, there are four, I guess, aspects that I really ensure that our team, myself, what we deliver. Essentially, first and foremost, the framework being we need to recognize our scope of practice. By understanding our scope of practice, how does that translate? Well, we're not going to go in and magically say to our clients, okay, we can fix X, Y, and Z, if it's not within our scope, we need to be very realistic with them and understand that we may need to on refer. So already that's building trust in the sense that we are staying in our lane, being truthful, ethical, and delivering our appropriate skill set for that client's need. Secondly, confidentiality. So, yes, that builds into not only, keeping their information secure, but also at the same time, what does that mean? It means that you're creating a space where that client feels comfortable to open up about their skin, the history, medical conditions, things that can actually impact that client's journey. For example, they may be going through menopause. So, allowing or opening that space for them to really talk about their journey without feeling judged. So, already that's creating another aspect of trust. And then a couple of other forms are transparency and professionalism and empathy. So, transparency in that respect is, being very honest with that client about, okay, let's say they're coming in and they are going through a acne journey. It's, explaining to them that it's going to be potential roller coasters, that there's more than just topical forms of treatments, that there's internal aspects, there's more to it. So again, that's building trust, going through forms of, what their plan's going to look like, the investment behind it, allowing that space for them to also ask as many questions as possible as well. And then lastly, as I said, professionalism and empathy is essentially showing them that you're a human, that you care, you're listening to what they're saying, right? So it's meeting their emotions as well. It's like you're a mirror a little bit with what they're saying too.
Gay, I wanted to ask you on the issue of trust. Do you think, what are your thoughts when you finish a treatment? What is the role of getting feedback from the client in order to assure, for example, if you mentioned something about the acne, that it's also there's internal changes and it could flare up a bit more, and basically the healing journey, and to explain the healing journey in at the end of a treatment, what strategy would you use to reaffirm that trust?
That's a really good question, Tina. I think that trust is built right from the get-go, right from that very first hello, how are you? That empathy. I think if you're talking about when you finish the treatment, is how are you feeling now? Not just get them off the bed, take them out the front and take their money. It's spending another 5-10 minutes with them. How are you feeling? Do you understand what we've actually just done to your skin? Do you understand the processes that are going to happen over the next coming days, weeks, or whatever? And you understand what we need you to use at home. Like, this is what you're going to be using at home because it's going to keep progressing the healing part to your skin. So I think it's just sitting down with them at the end of it, not just rushing them out the room. Okay, let's make your next appointment. Da 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 da. I'll see you in 3 weeks. It's great to see how you are.
That's what they normally do. They said, "Thank you, yeah, see you next time," and they walk out and see all those habits we've got to stop, don't we?
Oh, 100%. And I think 100%. And I think it's that, I always, when I was in my clinics and had my clinics, I always used to say, after we've gone through that process and we get out the front, I think that, we always said, look, I'm going to call you tomorrow, or I'm going to call you on whatever day. I'm going to call you at around 10 o'clock. Is that okay for you? And when that day comes, I'm going to call them right at the time that I said, because they're going to look at their watch and go, oh, she's forgotten about me. She hasn't called me. So again, the trust has just gone out the door.
Correct.
Do you know, like everything they've done.
maintain the tone.
Yeah.
But that's a good point about the follow-up phone call. A lot
Yeah.
of people do it initially and then they drop it. So it's about maintaining those connections. Melissa, your thoughts?
Yeah, so it's exactly that. So I think people, they are very slow in the beginning and they build all this trust, and then over time it gets relaxed a little. But in our clinic, like every time if like, how's it feeling? Like at the end, oh, it's a bit stinky. That's fine. We got 5 minutes. Like we'll fan that if it's still feeling hot. Oh, it's okay. I'll sit you up slowly. Did you want a drink of water? Just making sure they're okay. And just verbally giving them their aftercare again. They're not going to take it all in, and we automatically send all of our aftercare, but just making sure they fully understand, they have the chance to ask any questions, make sure that they know what to expect in the next few days, what their aftercare should be. And then sometimes it's as simple as, if you have any concerns, please just reach out to me. I'm always here if you have any questions. But Gabe calls. Our clients are like, they're in lockdown buildings a lot. And so we text. And so I'll be like, I'm going to text you tomorrow. I'm going to text you on Monday. Make sure you're doing okay. And that text message goes. And that gives them just that opportunity that if then they have a question or they think something might not quite be right, I've opened the door for them to bring that to me. And it's just like, how's your skin feeling today? Just make sure you let me know if you have any questions or if you're worried about something. And they can if they wish. And most 9 times out of 10, they go, everything's fine, thumbs up, move on. But it's just making sure, and it's just keeping that communication open even after they're out of the clinic, to know that I'm still thinking about them, I still care about their progress. If they've started a new product, checking in with them a week later, being like, how's the new product going?
Really, what I'm hearing is the new design of the communication style is you have to constantly take the lead in retaining the connection and reaffirming that you care.
Mhm.
So that's a strategy that has to be learned, because if you're used to just getting out the door and forgetting the client, and that's a pattern that you've used, it requires a shift in your perspective, a lot more effort, and also honesty and integrity. So when you're reaching out with care, they can sense that you really mean it. So we're going to move on to your question, which is a little bit different.
Yeah.
And that is, what is the most important addition to the consultation process in protecting against adverse reactions? So this is more a skin one for you. So what are your strategies with that?
So I think the most important part is actually not when you are attacking a consultation or approaching a consultation, making sure that you're actually moving from the mindset of, here's the consult form, here are the contraindications, let's go, and moving more towards, how am I going to treat this person that is sitting in front of me? Because everyone has different likes, dislikes, lifestyles. You could have two people walk in one after the other, same concern, but you would treat them very differently, because one may be in an office building and have kids and never see the sun, and one may be a woman that's a tradie. And so you can't assume what somebody's lifestyle looks like. And so by getting to know the person that is sitting in front of you through a thorough consultation, it is more than just, so it's like their health. It is, where are they up to in their hormonal health? Are they still cycling regularly? Are they perimenopause? Are they postmenopausal? Because you can't necessarily treat a 20-year-old that is going through regular cycles the exact same way as you treat a postmenopausal woman, because their healing is different. You need to understand their health history. And so it's becoming even more complicated in our industry, because people are sicker than they have ever been before. They are on more medicine than they've ever been. And so having an understanding, not just of, this medication is contraindicated to this laser, but even, how is this blood pressure medication going to interact with my skin needling? Do I need to make any adjustments of how I'm going to treat this person because of this medication or because of this health history? And so we need to have a bit more of a deeper understanding of health and a person as well. And so there are other things that we need to take into consideration too, is their preferences. So like me, I can peel. I have no problems. I could do a big peel. I won't pick at it. But some other people, even girls in my clinic, not a chance would I do a peel on them. I know they love to pick. They would peel at it. And so even just understanding what a person's like, whether they're anxious, are they stressed, what are they like when you treat their skin, you can prevent adverse events by just knowing those little things about them. So you're not going to pick up the wrong treatment and they're going to be unhappy and they're going to peel at the skin and then they're going to have big raw skin left because they can't help themselves but to pick. And so it's about knowing the person that's in front of you, not just being like, okay, you have acne or you have pigmentation and this is how I treat it. So I think the most powerful part and the way to make the safest and the most effective treatment plans is just the whole person, not the skin. And so
So,
lifestyle, medications, hormones, what their goals are, what their concerns are, it just minimizes your risk overall, and you can make a really great and effective treatment plan that's going to be right for that person.
Gay, what are your thoughts on what Melissa shared?
I absolutely love what Mel just said. Like everybody has their own unique DNA. Everybody has their own DNA. So no one's going to come in that's going to be exactly the same as the last person or the next person. So that individual assessment, that individual sitting down and chatting with them and finding out exactly what their wants, what their needs are, is really super important. I think too often we are so scripted. And that comes from, like, I come from that era way back then, like this is how you do a consultation. You use a clipboard, you do this, and it's the same every single time. And what Mel said, like that everybody has different issues and everybody's going to deal with their skin in different ways once you've done the treatment. You will get those pickers and you will get people that'll just put up with it. So it's just really understanding, I guess, and reinforcing what their personality is like. And that's really hard to actually determine in that first 30 minutes that we actually spend with them. Like we're not magicians. So it's just, I think, just getting down to forget the script. Just let's ask the questions that are relevant to the person and to their needs. Yeah, I absolutely love what she said.
Dee, what are your thoughts about risk management? How would you handle it?
Absolutely. Well, everything that Melissa has said, she basically nailed it. That's 100% how I would approach it in consultations, but also from another aspect too, I actually also ensure to bring in the aftercare form pretty much from the start, because if the client already has any inkling to say that they can't follow any aftercare, it's pretty much an automatic no, we can't go ahead with your treatment today. And being completely honest in that way, because if they can't even follow that, then at the same time, that already pretty much extends the risk of an adverse reaction from occurring, basically.
What I've seen with the aftercare, often when with court cases that we advise, often the aftercare is just given to somebody without explaining that this is really a risk management guideline to so you've had a laser or something, and then as you're driving it, you feel a bit itchy, so you could scratch it, and what you're doing is you're activating it. So I'm finding the thing that we put in our risk management document is if someone's got a language barrier, you've got to have an interpreter to go through that aftercare instructions so they fully understand why it's important for them to follow through. And I'm not really happy with some of the aftercare documents that I'm viewing. That some of them are very old-fashioned. They look with pretty faces and just do this and that, and they make it look like it's something superficial that it doesn't. It's the purpose of the aftercare is to prevent something going wrong, and you want that person to follow through with you. But again, as you've all mentioned, unless you build that interactive relationship where they talk to you, you talk to them, and there is that partnership and a commitment for the collaboration of what's happening, that they have a role to play, not just you. They just don't lie down and you do magic on them. It's about a give and take. And until you instill that in them, they could take that aftercare instruction, put it in the bag, forget about it. And this is why another instance where I was at a conference and there was a lawyer who stood up and said that the problem with aftercare, people think you just give it to somebody and walk away. By law, you should be standing there and making them read it with you and say, do you understand? Do you have any further questions before you move away? It's not an issue of just handing it or getting somebody to sign something. So you guys have covered some very, very good points. Now, Rose was supposed to come, but because she got delayed in her flight, her question was, what should a good consultation reveal? In other words, what is that process that you're going through going to protect you and give you the right answers? So what do you look for to gain from the way you perform your consultation, the questions you ask before you make a decision of your plan? So I'm throwing that out. Whoever wants to start on that one, I'm happy with. Gay, do you want to start?
Yeah, I'm happy to start. The first thing I think is really understanding exactly what they want to see changed on their skin. That's a really important question. There's no point in doing a consultation if you have no understanding about how they feel. So when they look in the mirror, what makes them feel sad or unhappy? So that's the first thing. And then you have to have identification of what has caused that. So when we look at causes of disformations on the skin, it usually is caused by internal. So, we only have a small percentage that's environmental. And sure, that, when we look at that percentage, 25%, 30% or whatever, there's a lot that actually do cause that external changes to the skin. But the exacerbation happens from what's going on internally. So, me breathing, if people don't breathe properly, that's going to cause a lot, something as simple as pigmentation, if they're not breathing properly, can be caused by that. So really understanding that, really understanding their hormone fluctuations. That just doesn't happen in perimenopause or menopause or postmenopause. It happens all through, their life, from the time they get up in the morning, their hormones are going to change. So how are they feeling on a day-to-day basis? And that comes down to that anxiety, those stress levels that we have to deal with. And then, and then we look at the circulatory system. How is their immune system? How is it functioning? And then you have to look at the digestive system. So, all the systems, the 7 systems of the body, we need to really understand completely because they're all integrating with each other. One's going to have a knock-on effect. We've got this little domino thing happening inside. We've got to find out what caused that first domino to fall. That actually has caused all the other things that we're actually starting to see on the skin. So I guess that exploration of going through that phase is something that is personal to every single person. And it actually needs to be individual. Like I said, their DNA is different to the next person to the next person. So it has to be very individual. So for me, actually really understanding the internal part, and this is something like if I had have said to my 20-year-old self when I first started in this industry, this is the things that you'd be looking at for in a consultation, I would have blown my mind. That's not going to happen. But here we are, down the track, having to understand all of these things. To us back then it was environmental. You're having too much sun. You're having too much of a party life. You're drinking too much. You're smoking too much. But my gosh, that was
Looking at the causative, you're looking at the exploring. So you're saying the objective of what you want to get out of what you want it to reveal is what caused the problem, and you're looking environmental as well as behavioral. See, the behavioral side is only relatively new. A lot of in the past that wasn't in any of our training, so it's interesting. So any other comments? And then I want to go to Leanne's answer and her question.
I think she absolutely nailed it, but like stress and well-being, it's so big now. You know, the amount of people that come in are just so stressed, or they're drinking their coffee on an empty stomach. First thing is, the minute they open their eyes, empty stomach, 2 cups of coffee, and how that shows up on someone's skin, especially someone with acne, and like 3 or 4 hours sleep. Like, how are these people surviving? If I get less than 8, I'm done. Don't talk to me for the rest of the day. And so it's about what are you doing, what are they doing in their life that is going to impact that. It's what they eat. The amount of people I talk to, I go, so what do you eat in the day? And they go, dinner. I'm like, what do you mean dinner? Just dinner? And then yeah, I have coffee in the morning and dinner. I'm like, okay, well, we're going to look at that too. And so it's more than just the skin. It's we have to get to the root cause of what's happening and why what is happening may be presenting on the skin.
Okay, did you want to say something quickly because we need to go to
Uh, Basically, everything that both Mel and Gay has said, I 100% agree with. We really have to take on the role of an investigator and really get down to understanding what that client is saying and their background. So 100%.
Okay, so the question I gave Leanne is how does the understanding of neuroscience assist in revealing the causes of disorder? So we're now approaching her to give us some of the deeper revelations, more clinical and you'll see when I read this out of her response, it really validates what you've done, what you've observed, but it's giving it to you from an evidence-based interpretation. So I'm just going to bring her thing up and read it out. Just lost it. Right. Okay, so what she said is the relationship between neuroscience and skin disorders is based on the understanding that the skin and nervous system are biologically interconnected. This relationship is often described through the connection of the brain-skin axis, which recognizes that psychological experiences, emotional state, and neurological processes can influence physiological activity within the skin. Research in psychoimmunology as well as psychodermatology have demonstrated that the psychological stress can affect the skin through multiple interconnected pathways, including the endocrine, the neuroendocrine signaling, immune modulation, inflammatory responses, oxidative stress. And then she also mentioned skin barrier function, which I thought was very interesting. So basically, skin barrier function can be affected by psychological issues. When psychological stress is prolonged or poorly regulated, these psychological processes may contribute to the onset or exacerbation of persistent of certain skin disorders. In other words, they can prolong and also make them worse. Okay, so we now understand that the stress of psychological factors can change the chemistry of the body and the skin. So she then goes on to talk about what studies are uncovering. Studies are uncovering the important role of the nervous system in regulating skin homeostasis. The skin contains an extensive network of sensory nerves and neurochemical mediators and that communicate with immune cells, blood cells, and other skin structure. That means the emotional and psychological states are not separate from the skin. Rather, they can influence the biological environment in which the skin functions. In conditions such as acne, rosacea, and other inflammatory skin disorders, research has identified associations between psychological stress and increased disease activity of symptom severity. However, the relationship is complex and bidirectional, as skin disorders can also influence psychological well-being, creating a cycle in which emotional stress and physical symptoms may reinforce one another. This research supports the importance of considering both the skin and the psychological factor that may influence its function. While psychological stress is not the sole cause of skin disorders, understanding the interaction between the nervous system, emotional experiences, and also skin physiology provides a more comprehensive framework for supporting skin health. And then she mentions that she has developed the psychodermic analysis method, which is a method that she works with because her area of expertise is in skin disorders as well. Within my proprietary psychodermic analysis framework, this understanding is taken one step further by recognizing and addressing the physical stress response alone may not be sufficient to fully understand the mechanisms contributing to stress-related skin changes. Rather, consideration must also be given to the psychological processes that initiate and influence these responses, including individual beliefs, perceptions, emotional experiences. Now she goes into the issue of, poor self-esteem and those issues, catastrophic thinking that you're always a failure, these kind of thoughts. This distinction forms the basis of the psychodermic model, which differentiates between stress-skin connection, referring to the psychological effect of stress on the skin, and the mind-skin connection, referring to the cognitive and emotional processes that trigger and influence those physiological responses. From this perspective, effectively addressing the relationship between psychological experience and skin physiology requires consideration of both pathways. Referring to a mid-skin connection without the different direction addresses a psychological process involves not just to fully present the complexity of the interaction between the mind, nervous system, and the skin. Now, then she's talking about this stress skin index. Now, it stands prevailing industry practice too often overlooking the influence of psychological factors in healthy skin. Neuroscience has now illuminated the intricate interplay between psychological state and dermatological outcomes, making it essential to integrate this understanding into a consultation protocol. To meet the contemporary client needs and professional standards, the consultation process must now evolve beyond the traditional method to include psychological links to skin health. Therefore, the development and establishment of rigorous industry standard tools used as a professional screening questionnaire for identifying stress-related contributors to skin health becomes a critical source for every skin consultation. I'm pleased to inform you that I'm currently developing this initiative by creating a stress skin index as accompanying training designed to evaluate relationship between perceived stress and skin symptoms, while identifying when the professional psychotherapeutic or medical support intervention may be indicated and provided to the appropriate referral pathway. Now, what she's asked me is, so basically what she's saying is, she's developed this simple questionnaire. Now, you do your own consultation, and there's a separate questionnaire that you get the client to fill in. So she measures things like emotional impact, functional impact, and symptomatic scores. So the scores. So you'll be able to identify if it's mild, medium, or severe. And the client themselves answer the question. She measures stress levels and symptomatic severity. So I said to her, well, what about who interprets the questionnaire? And she said, well, you can immediately see if there's a need, there's a deeper issue. And then you can say, look, going by your results, you could get a lot of help if you saw a specialist who could help you in your thought life, and how you process things. And would you be open to that? Because we believe that, because you are experiencing high stress levels, as you indicated, because you look at the chart, would you be open to that? And if she's open to that, then you can then direct them to her. Now, she is working on, it would be something that she would, she wants feedback as to you guys, do you think that would be a useful tool? For example, if you had somebody with dysmorphia, this would come up and you could say, it would be good if would you be interested in speaking to somebody who could help you in that area? Because what she said is that you can do all the good things with physiologically if her neurological process is creating inflammation and changing the chemistry of her body and triggering hormones to reactivate the condition. You can work as hard as you can. She's sabotaging you because her negativity and her aggression, or her her grief, or whatever it is only reactivating the problem. And she's identified that sometimes it's the psychology that's caused the skin, and sometimes it's the skin that's caused the psychology. So in an acne situation, it could create grief and poor self-esteem. But someone with poor self-esteem and grief can trigger acne. They can trigger rosacea. They can trigger eczema. So basically, we're now going a little bit deeper, more clinical, in finding the source of that situation. So I'm going to put it out there. So what do you guys think about encouraging her to develop that particular questionnaire?
Do you want me to speak, Tina?
Yeah.
I think the questionnaire would be probably a good tool. I just don't know that if you're treating a client or having a conversation with the client and they fill out that questionnaire and they do need to go and have some help with stress levels, I don't know if everyone's going to be receptive to that. Like, I just think sometimes it could be us understanding what's caused the skin condition. But I just think, us referring them to a psychologist or referring them to someone like that could be, although they probably need to go to that, it could be overstepping the mark with that client in some ways. I think I'm big on referring. I refer to everybody, my clients, to everyone that I can, or used to. But I just also think there's that personal touch that we can overstep our boundaries. And I think, talking about scope of practice, are we going outside our scope of practice? I think
No, she's very into scope of practice. What she says is you will not be doing diagnostics. What you can do is you can't interpret everything. What you can see the markers to say there's a mark there that shows possibly you could benefit. But she said you're not allowed to be, you're not responsible for the full diagnosis. No, because that would definitely be going outside.
Oh, 100%. I think, when we look at diagnosing a skin disorder, that's only going to be given by the information that the client gives us. So we can only come up with a solution that has been determined by the honesty of that person and what they give us. So,
she's got scores there. How frequent, like you pick your skin, how frequently do you, she says sometimes, or then it's no big deal. But if she says I do it regularly, she's got something. But you know what? There's two things that come to mind here, and unless I get them out, I forget them. So I'm sorry to butt in, but I feel that you got a point in that. I think what you've developed, Gay, is probably the step one that people need to do. And once they master that, then maybe at another year, a year later, this could probably be something they're comfortable with. Having said that, do you know now that the government, the APRA, requires that physicians evaluate and make sure that people that are wanting cosmetic procedures, if they have mental issues, they they're not allowed to do anything unless they see a psychologist. So it's now been implemented into cosmetic medicine that the psychological state of the patient has to be clearly considered to be safe to make decisions for themselves. And if there is a problem, you need to refer them, because I tell you what, there are so many mental health problems out there.
Oh, 100%. I totally agree.
Melissa,
think-
what are your thoughts?
I think I reviewed the framework. I think I consider most of those things. I'm sure, Gay, you actually consider most of, or in work practice when you were a trainer, you would have considered all of those things anyway, without a piece of paper that and so I think for somebody that is new to exploring stress as a reason for skin conditions, a framework could be good. Maybe not necessarily for referring, or for discussing with the patient about their mental health conditions or things like that. That's a very personal thing. I don't think that should happen day one. Maybe the questionnaire and you get an idea of what's going on with the person's stress levels. And maybe you just hold that as a tool. So if things aren't responding the way that they're meant to, or the way that you would anticipate, you could draw back once you have built the trust with your client. They've seen you a few times, they're starting to get a little bit of results. You've had some discussions, because then then it's a bit easier to approach that. I feel like if you came in straight off the bat being like, well, you're really stressed and you need to see a psychologist, they'd be like, no, thank you. And so I think like it's a great way, because I look at all of those things. I look at their stress, their sleep, where they pick what they do. And I think you need to assess that as a reason why and have an understanding. And maybe at a later date, be able to be like, is this why things are not responding the way that they're meant to?
Just Melissa, Gay's got to go. So I just want to say that, Gay, can you please give us where people can get your book from? I know we'll be promoting it through the APAN website as well, but
They can get it through APAN.
Okay, all right. Well,
Or through APAN or on my website, but through APAN or on my website.
Yeah, but we highly recommend it. It's a very, very, very good resource, and I think it will create a good foundation for perhaps, maybe this particular tool to be useful at a later stage, but probably the industry is a little bit reluctant to move into that. That's what I'm getting. What are your thoughts, Dee?
I have to go, so thank you so much, everybody.
Thank you very much, Gay. It was a pleasure having you, and thank you for
Great to
sharing
be
your
here.
knowledge.
Thank you.
And everything you're doing for the industry, especially in upgrading the whole consultation thing to the level that now it's needed. You got it right, Dee.
Bye.
Okay. All right. Thank you. Okay. All right. I can't hear you now.
Her audio's not working by the sounds of it.
Oh, you stuffed the audio. Anyway, okay. Well, it's time, so we need to wrap it up. But thank you for all your input. I thought it was a good session, and I want to encourage everybody to like and subscribe if they would like to continue to support us. This is very important to us because these sessions bring together a lot of industry intelligence, and they are so useful, and we've had really good feedback. But please give us, by liking and subscribing, it allows us to come further up on the YouTube sections. That really helps us with that. So thank you, and I look forward to seeing everybody next time.